right. Hey everyone, it's Dali Begum, your MPP for Scarborough Southwest. It's the third week of the legislative session since we started, and I wanted to come on here and just say hello to everyone, but also give you an important update and talk to all of you about some of the things that we've been doing in the legislature. Hello everyone, thank you so much for joining in. I hope you're all staying healthy and safe. It's the third official week of legislative sessions here, and there are lots of things that are happening, or I should say brewing, and I wanted to give you all an update of what's happening, and also kind of tell you that there are a few things that I think everyone in Scarborough Southwest, everyone in this province or this country should be aware of. And I know there are a lot of people who are actually reaching out to our office. I've received some calls from people, a lot of constituents who are very concerned with what's happening with our healthcare system in the province. That I know, and I see some of you who have joined. Hello everyone, thank you very, very much for joining in. Walaikum assalam. Thank you very much. Thank you for joining. Today I actually want to talk about healthcare, and I want to talk a little bit about and answer any questions you may have about what's happening in our province, specifically with Bill G7, and that's the More Beds, Better Care Act. Now, don't be fooled by the actual title of the bill. We know that this government brings forward bills like, that sound amazing, just like this one, More Beds, Better Care, does not necessarily mean that this bill actually has things that will actually support people, actually provide better care for people, and it doesn't necessarily mean that it'll provide quality care or quality beds for people in this province. So as you might have seen what's happening in the media and what some of the conversations have been like, I wanted to give you an idea of what Bill G7 is all about. And tomorrow we're back in Parliament and we're going to be debating this. So if anyone wants to share some of the feedback as well, I would love to hear your thoughts and your concerns and things that you want me to ask this government. Please do send them to us. I'll make sure to share our email address, unless you already have that, and our contact, so that you can write to us as well, or you can just comment in the comment section and let us know. So Bill G7, what it does, and you've probably heard about it last Thursday, is that it actually allows for hospitals to send loved ones who they think qualify for something called ALC, which is alternative level of care, and it basically applies to anyone who's occupying a bed in the public hospital system, and they can just be shifted to any long-term care space in the province without consent. Now imagine having your loved one, imagine having your mom and dad at the hospital who need some level of care, and without you knowing, they just get sent to another hospital, or another long-term care home that you did not consent to. And this is has been a lot of people, a lot of advocates have come forward and are very concerned about it, have been also warning about the impact it has for the health of so many of our seniors, what it would mean for their mental health, for their physical health, the type of care they would receive in these places, in these temporary long-term care homes that they would be sent to, and you basically have no rights. You don't have a say, and these patients, the seniors, they don't have a say either. And what it means for so many of the people, over 5,000 people who may be impacted by this bill, where they can be just shifted off, to another place. And we saw this happen during, or part, a way this was done during the emergency time during COVID, in one of the waves, where hospitals had no choice but to actually send them to different places, because they didn't have the capacity to care for some of the patients that came in. So patients had to be moved to, let's say, from Scarborough to Cobark, for example. But we're not in a situation where you have to do that if you provide support that our public healthcare system needs. And so obviously we're going to be debating that tomorrow. I want to hear from you. I want to hear, hi Matt. We're debating Bill G7 tomorrow, the More Beds, Better Care Act. And so send us your thoughts and just sharing some ideas about it. And yeah, I wanna hear from local constituents, local people in Scarborough Southwest. If you have been impacted by this, if you're hearing from any of the hospitals with your loved ones who may be facing a situation like this, please do get in touch with us. It really is something that is going to violate the rights of patients. We have the Human Rights Commission that, and yeah, thank you so very much. You're absolutely right. This, we need all the support to fight back, like also against the privatization of our healthcare system. As you can see, this government is letting the province's healthcare system, continue to deteriorate so that they can allow it for it to become privatized. And from what we're seeing, the way they have allowed for staffing, for support to go into private healthcare, and this sort of shift, it is a really dangerous move when we talk about our public healthcare system, when we talk about the universal healthcare system that we have, that is our pride in Canada. This morning we had questions my colleagues have asked, which related to stories that people brought forward. And one of the stories actually a colleague shared with me, privatization, also known in conservative talk as innovation. So every time I hear the word innovation from the Conservative government, it is extremely worrisome. It is very concerning, because what they really mean is privatization. When they talk about innovation, that's what the Minister of Health talked about the other day, when she talked about the new innovative ways that they're going to free up beds. It's through privatization. And the story that I want to share is we had examples that people brought forward where we have seniors who are actually delaying care, or are really scared to go to the hospital because they don't want to be taken to a place that they did not consent to, or that they don't know. And that's just very scary. I also can't imagine a situation where you have you need care, you need urgent care, and because you're so afraid, you're not able to go and do that. And we have seniors who are in that situation right now. We also have people who shared about their grandparents that are considering like medically assisted death, dying, because they would rather choose a path like that than end up in a home that feels like a prison cell. And sometimes we've had situations where people end up in homes that are not the safest, that are not that don't have proper food, that don't have proper support, that don't have air conditioning. I was just debating this last week actually, about the conditions in long-term care homes. So we want our seniors to have the best care. We want everyone in this province to get the best health care. We want everyone who needs emergency care to be able to go to the hospital that's nearest to their homes and get the care that they deserve and they need. So we're going to continue to fight for that. And I thank you all for your support. Please do stay in touch and let us know if you have any family members who may be impacted by Bill G7, or if you're hearing anything similar to what's happening with ALC patients, and if there is anyone that in the community that are impacted by what's happening and the new order of being shifted to another location, or if you're a loved one and you have someone in a hospital where you have been told maybe we need to take you to a rehab, or you may need to take them home because we don't have capacity and you don't feel that they're in the right condition right now. So please do let us know, and continue to stay in touch with what's happening. And it's an honor to serve the community of Scarborough Southwest. So I wish you all the very best. Take care, everyone. Bye-bye.